Oh, hello, and welcome to our neurology office. Do you have an appointment today? Perfect. What's your name? Okay, and your appointment was for 8 p.m., is that correct? Okay, excellent. And just to confirm, what is your birthday? I think I've found you in our system. It looks like you have an appointment with one of our finest doctors for a cranial nerve exam. Does that sound right? If you're not familiar, and if this is your first time here, which it looks like it is, a cranial nerve exam evaluates 12 pairs of nerves in your neck and head area that deal with your senses, your vision, sight, smell, and of course, hearing. It connects all senses to very important elements of daily function, like muscle movements and your reaction times and such. And our doctors use simple, basic tests, such as checking movements, facial expressions, and other reflexes and tests of your senses to pinpoint any neurological issues that you might have. So today we're going to perform some of those tests, and do not worry, you are in great hands. I do have to ask some more basic questions so that we can better diagnose and register your results in a more appropriate and specific manner to your needs. So, if you don't mind, I'm going to get ready here and go ahead and ask you some of those questions. Does that sound good? Okay. All right. For my first set of questions, how are your sleep habits? Would you say you get an adequate amount of sleep each night? Preferably 6 to 8 hours? Or do you get less? I see. That does sound fairly consistent, and it's good to hear that you're making an effort to rest as much as you can. Sleep is very important, and you'd be surprised how a poor sleep schedule can impact other elements of your daily life. Leading off of that question, how would you say your caffeine intake is? Do you have more than your normal share of caffeine on a daily basis? Or maybe just a cup of coffee in the morning? I see. You do like your coffee. That's totally fair. Most people enjoy coffee quite a bit, but it's always better to exercise caution because, after all, caffeine is a drug. So, moderation is key. Okay. have you been having any issues with your vision recently? Okay. Do you wear glasses or contacts normally? Okay, alright. That's totally fair. I forget mine myself sometimes. Would you say that you have a sensitivity to light? Does light bother you? Not just in the morning, of course. No one likes to be woken up by a bright flash of light, but in your normal daily life, do you find yourself averted to bright lights, or do they cause headaches or stress? Okay, okay, okay. Do you have any history of colorblindness, or noticing that colors seem inconsistent to you when asked about color patterns or things you might see that appear different to yourself than other people? Okay, well, our doctor will certainly look into that and go through some tests that can rate how much color blindness you may have, if you do indeed have any. So do not worry, it's more common than you realize. Just adding to your file here. Alright, moving on. How would you say your hearing is? Have you had any hearing problems in your life, such as having trouble distinguishing what someone is saying at a normal speaking volume? Okay. Are you consistently around loud noises or things that could possibly cause hearing damage? And would you say those sounds are ever over 90 decibels for more than 30 minutes? Okay, not bad. Do you find it difficult to hear low sounds of a deeper frequency, or possibly higher sounds of a high-pitched frequency? Okay, so you find it slightly more difficult hearing high pitches. Alright, well, most things here seem fairly normal. Have you had any recent injuries? Okay, staying out of trouble. And have you had any prior surgeries that we should be aware of, particularly pertaining to your nervous system or things that may have affected your head, such as a concussion or your spine? Excellent, excellent, excellent. It's good to keep those areas protected, so make sure you're wearing your helmet if you're doing any activities that involve wheels or speed or other things of that nature. Okay, moving on to taste. Have you noticed any changes in your ability to taste certain foods or certain palates? Okay, okay. What about flavor profiles, like salty or sweet? Okay. And do you have a preference towards salty or sweet? Perhaps you have a sweet tooth? Alright. It looks like we've managed to establish a pretty complex profile for you here. So, on that note, a more fun question. What's your favorite movie? Oh, a horror fan. I see. I like those as well. You like the things that keep you up at night. Well, as long as it's not affecting your sleep, I will not complain. Alright, it looks like I have everything I need. So, the doctor will see you now. Have a great appointment, and we'll see you afterwards.
Oh, hey, how are you doing? Great. Well, Max already told me that you went over the standard questions with him. That's great. Well, let me just write down your information and, well, we can get started, okay? All right. Okay, let me just put this aside. Okay, well, I'm gonna start by just feeling around your face and some parts of your body in case you feel any pain or discomfort. Okay? Alright, we'll start with your face, okay? First with your ears. How's that? Okay. How about that? Right. If you feel just the slightest thing, just tell me, okay? Alright. Now your chin. Okay, and your jaw. Alright. Now I'm gonna do your neck. Okay. Now your shoulders. Okay. Now, could you shake your head no? Very good. Shake your head yes. Very good. Now, if you could just put your arms out like this. Okay. Could you make a fist with both? Okay. Now, only the right one. And now the left one. Very good. Now, some face expressions. Could you smile for me? Like that. Very good. And now, give me a frown. Alright. Okay, now, I'm gonna need you to close your eyes. And I'll just poke you with this stick. Oh, no, don't worry. It's not sharp or anything. You can feel it with your hands. It doesn't hurt, I promise. So, as I said, I'm gonna need you to close your eyes. And I'll just poke you in the face with this stick. And you need to tell me if you feel it on the right side or left side of your face. Okay? Alright. Then close your eyes and tell me. Very good. That was the right side. How about now? Left side. Very good. One more. Left side again. Very good. Okay. Now, we're going to move on to the sight part of the exam. So, I'm going to start by just taking a look at your eyes. Okay? Alright. Well, I'm gonna get this light and just shine it directly at your eyes. Okay? Now, without moving your head, could you just look up? Okay. Very good. Now, look down. Now, look to the side. Very good. And to the other side. Okay. That was great. Now, I'm gonna need you to look at these pictures and you need to tell me which shape and which color do you see. Okay? Alright. A blue square. Very good. Here's the next one. Yellow circle. Alright. How about this one? A purple triangle. Okay. A pink star. Very good. And here's the last one. A green arrow. Great. Alright. Oh, now I'm gonna need you to put on these glasses. Okay? And we're gonna test your peripheral vision. Alright. Do you see that red dot right in the middle? I'm gonna need you to focus on it. Alright, and around there are gonna be little white flashes. And I'm gonna need you to count them. Okay? Alright, here we go. Alright. How many was that? 8. Very good. You did perfect. Okay, so now we're going to do a colorblind test. I'm sure you've seen some of these somewhere. Yeah, they're the little circles with more circles and different colors. That's right. So, you just have to tell me which number do you see in this picture? 74. Very good. What about this one? That's number 5. And what about this one? That's 12. Very good. Alright. Now, we're going to do a bit of a different test, okay? It's a bit unpopular with the patients, but I promise you it's not that bad. Okay, so I don't know if you've heard it before or done it before. It's called the blowing test. Okay, well, don't worry, I'll make sure to explain it. So, I'm just gonna need you to place your head right here. You can put your chin right here. There you go. And then I'll just put your eye right through here. Okay. And now you should be looking at a picture of a long road with a balloon at the end, right? Okay. Well, I'm gonna need you to really focus on the balloon. Okay? and then I'm not gonna give you a signal or anything, so you cannot expect it, and then I'll blow in your eye, okay, with the machine. I know it sounds uncomfortable, and it kind of is, but it's medical procedure, okay? Alright, well, then just focus on the balloon. There you go. How is that? Oh, well, let me just take a look at how it came out. Oh, I'm sorry. I think you blinked. We have to redo it. I'm sorry, we'll just do it quickly, okay? Just focus on the balloon again. There you go, just look at the balloon and try not to think about it. Much better, right? Okay. Well, let me see. Yep. We got it this time. It wasn't so bad, was it? Oh, okay. Well, now we have a much more relaxing test, in my opinion. We'll just put these glasses on you, okay? Alright. And I'm going to switch between two pictures, and you just have to tell me which one do you see better. Okay? So, number 1 or number 2? Mm-hmm. Number 1 or number 2? Okay. Number 1 or number 2? Okay. Number 1 or number 2? Mm-hmm. And the last one. Number 1 or number 2? Okay. That was very good. Let me just take this off of you. Alright. And now I'm going to get this chart. Okay. And I'm gonna ask you to cover your right eye. Mm-hmm. There you go. And now, can you read the 3 big letters on the left? Very good. Those were the easy ones. Now, could you read the first line on the right? Okay. How about the second one? Okay. Now, cover your left eye and read the third one. Very good. The fourth one. Mm-hmm. Now, switch back and cover your right eye and read the fifth one. Mm-hmm. What about the sixth one? Very good. And the last one. Okay. Very good. Now, the next part of today's exam will be the hearing test. So oh, forgive me. I'll be right back.
Hello again. It seems the doctor's a little busy at the moment, so rather than keep you waiting, I'm going to take over for a bit. I'd like to pick up by performing a brief hearing test. So, if you don't mind, I'd like you to close your eyes, and I'm going to make a tapping sound, and you're going to raise your hand on whichever side you think it's coming from. So, if you hear the tapping in your right ear, raise your right hand. And if you hear the tapping in your left ear, raise your left hand. Is that good? All right, perfect. Let me go ahead and start. Good, good. Excellent. All right, let's continue. Good. Yes, yes. Mm-hmm. I tried to trick you there. Your hearing seems to be on point. Now, I'm going to say a few words, and I want you to repeat them back to me. I will add one word each time, so try to remember what each of the words are. I think you'll do fine. Let's begin. Our first word is food. Food, sock. Food, sock, night. Food, sock, night, thumb. Food, sock, night, thumb, jail. Food, sock, night, thumb, jail, rose. Very good. Food, sock, night, thumb, jail, rose, coin. Very nice. And for our last stage, food, sock, night, thumb, jail, rose, coin, witch. Repeat it back to me. Very good indeed. You seem to have excellent memory. All right. Very good. I'm going to perform one more auditory test, and then I will pass you back to the lovely hands of our doctor. Go ahead and once more tell me which ear you're hearing the sound. Very good, and one more. I see. Okay. Well, I'm going to make a few quick notes here. to be sure to leave our doctor with as much results as possible to perform his evaluation. So, if you don't mind, I'll go ahead and pass back to him. But it's been a pleasure, and I'll see you up front on your way out. Bye for now.
Hey, sorry again for keeping you waiting, although I see here that you went over most of the test with Max. Well, that's good. Okay. That's pretty good. We'll just do a couple more, but you pretty much covered all the bases. So, let me put that away. Alright. I'm just gonna get this pen, okay? And you're gonna close your eyes, okay? And I'm going to click it around your head. And you need to tell me how many times I click it each time, okay? Alright. Well, close your eyes. Very good. Three times. Very good. That was 6. Very good. 1. Almost tricked you. 'How many was that? 8. Very good. Well, it seems like your hearing is great. Now, let me just do one final check, which is using this tuning fork. Okay? I'm just going to hit it, and you just let me know if you hear it or not. Alright, how's that? Perfect. That just means that your hearing is great. So, now we're going for the last couple of tests, and these are way easier, I assure you. Okay. This one is the taste test. I have here, as you can see, a blank packet of bubblegum. It's all white on the outside. It doesn't have any tags, any colors, any fruits that can give away the potential flavor, so as to not to, give you any hints. So it's pretty straightforward. You just get one. There you go. And you just tell me, what do you think it is? Yeah, don't worry. Just take your time. And you know what? I think I'll have one too. Yeah. I think it's mint. I mean, I don't know if I like it. No, take that out. But yeah, I think it was mint. So, you got it right? Alright, and now for the smell test. In this one, we have two separate ones, okay? The first one is this little crystal bottle of essential oils. As you can see again, it's transparent and it doesn't have any tags or anything. So I'll just take it out and you just give it a big whiff and tell me, what does it smell like? Huh? Yeah, I guess I can see that. Alright, well, and the next one, it's a bit different because it comes in a spray bottle. So I actually have to spray it around you and around the room. So, it's supposedly a bit harder to get the smell. So, okay, how's that? Oh, sorry if I got you a bit wet. Yeah, I guess it smells kinda citrusy, like lemons and lime. Well, I think that's it. Yeah, we're all done. And you did great. You've passed with flying colors. You aced all of the 5 senses: touch, sight, hearing, taste, and smell. You did great in all of them. Congratulations. There you go. Well, it's been great having you here today. And, well, we do recommend getting at least one cranial nerve exam a year. So, if you want to schedule one for next year or maybe in 6 months, Max will be glad to help you on your way out. Great. Well, I'll see you soon and hope you have a great day. Goodbye.